Top 3 vitamins every diabetic should take. Lower blood sugar. When you're managing diabetes, doctors often focus on cutting sugar-taking medications or monitoring blood glucose. But there's a critical piece they rarely dive into: the role of specific nutrients. Without the right vitamins, your insulin won't work as effectively, your nerves can weaken, and complications like heart disease or vision loss can sneak up faster than you'd expect. Here's the kicker. Most diabetics are deficient in key vitamins and don't even know it. Ever feel exhausted no matter how much you rest? Struggle with tingling in your hands or feet? Or find your blood sugar hard to control despite your best efforts? Your body might be crying out for these nutrients. Today, we're breaking down the top 3 vitamins every diabetic should prioritize, why they matter, and how to get enough to feel better and manage diabetes more effectively. If this video helps you, please hit that subscribe button to support our work. Let's dive in. Before we start, a quick note: always consult your doctor before making changes to your diet or supplements, especially if you're on medications. Now let's get to the first vitamin that's a game changer for diabetics. Number 1, vitamin B6. Vitamin B6 doesn't get much spotlight, but for diabetics, it's a powerhouse. Your body burns through B6 faster when blood sugar is high. Why? Excess glucose makes your kidneys flush out B6, and the oxidative stress from diabetes demands more of it for cell repair. Add to that common diabetes medications like metformin or certain blood pressure drugs can deplete B6 even further. The result: many diabetics are running low without realizing it. A B6 deficiency isn't always obvious, but if you're battling fatigue, brain fog, or mood swings, it could be a clue. One major red flag is nerve problems, tingling, burning, or numbness in your extremities. Since B6 is vital for nerve health, low levels can worsen neuropathy, a common diabetes complication. Other signs include muscle weakness, poor coordination, or dry, flaky skin. You might notice frequent mouth sores or catch colds more often because B6 supports your immune system. In severe cases, low B6 can lead to anemia, leaving you dizzy, pale, and short of breath. B6 is also critical for fertility. In men, it boosts testosterone and sperm quality. In women, it regulates cycles and eases PMS. Low levels can dampen libido by disrupting dopamine and serotonin, which control mood and energy. Your nervous system relies on B6 to repair and protect nerves, so without enough, nerve damage progresses faster, amplifying pain and slowing recovery. Your kidneys need B6 to combat inflammation, and low levels increase the risk of kidney complications. Eye health is another concern. B6 protects the tiny blood vessels in your retina, and a deficiency can accelerate diabetic retinopathy, leading to vision issues. For your heart, B6 lowers homocysteine, an amino acid that damages arteries and raises the risk of heart attacks, strokes, and high blood pressure. Without enough, B6 blood vessels stiffen, worsening circulation problems common in diabetes. On a cellular level, B6 is essential for glucose metabolism. It helps break down glycogen, your body's stored glucose, for steady energy release instead of spikes and crashes. It also supports neurotransmitter production, so low levels can trigger anxiety or depression. B6 is needed for hemoglobin, which carries oxygen in your blood. Without it, you feel fatigued and wounds heal slower. Clearly, B6 is a multitasker, and diabetics can't afford to skimp on it. So how do you get enough? Food is the best place to start. Chickpeas are a top source. 1 cup cooked gives you about 55% of your daily B6 needs. Beef liver is another heavy hitter, offering 50% per 100 grams. Wild-caught salmon provides around 40% per 100 grams, doubling as a great protein choice. Turkey delivers 40% per 100 grams, and sunflower seeds pack 30% per ounce. These foods don't just supply B6, they support nerve health, immunity, and metabolism, making them ideal for diabetics. If you love gourmet meals, try these B6-rich dishes. A Mediterranean chickpea and grilled lamb salad with lemon tahini dressing, 200 grams of lamb, and 1 cup of chickpeas delivers over 80% of your daily B6 plus amino acids for muscle repair. A Japanese-style salmon teriyaki with roasted chickpeas, 180 grams of salmon and half a cup of chickpeas covers 90% of your needs while providing heart-healthy omega-3s. Or try a French-inspired beef liver pâté with garlic mashed potatoes, 100 grams of liver and 1 medium potato giving 85% of your B6 alongside iron and B12 for energy. If food alone isn't cutting it, supplements can help. Look for bioavailable forms like pyridoxal 5-phosphate or P5P. Thorne Research's P5P at 33 milligrams per capsule is a great option for nerve support. Pure encapsulations, vitamin B6 at 50 milligrams per capsule is another solid choice. Most diabetics benefit from 25 to 50 milligrams daily, but higher doses should be monitored by a doctor to avoid toxicity. Some habits can worsen B6 deficiency. Refined grains like white bread or pasta lose most of their B6 during processing, so opt for whole grains. High sugar diets burn through B6 faster as insulin spikes increase demand. Alcohol impairs absorption and speeds up B6 breakdown in the liver. Medications like birth control or metformin can also deplete it, so if you're on these, talk to your doctor about boosting your intake. Vitamin B6 is a must for diabetics. It enhances insulin function, protects nerves, supports heart health, and keeps energy stable. If you're dealing with nerve pain, low mood, or stubborn blood sugar, B6 could be the missing link. Let's move on to the next vitamin. Number 2, vitamin E. Vitamin E is like a shield for your cells, guarding nerves, muscles, and blood vessels against oxidative stress, a major issue in diabetes. High blood sugar creates free radicals that damage tissues, forcing your body to use up vitamin E faster. Since it's fat-soluble, it needs healthy fats for absorption, but diabetes can impair fat metabolism, making it harder to maintain adequate levels. Low vitamin E doesn't always scream for attention, but subtle signs include muscle weakness, trouble with balance, or worsening neuropathy symptoms like numbness or tingling. Dry, irritated skin or slow-healing wounds can also point to a deficiency. If you're squinting at night or straining your eyes low, vitamin E might be harming the blood vessels in your retina. Frequent infections. That's another clue, as vitamin E bolsters immunity. A vitamin E deficiency impacts multiple systems. For fertility, it's essential. Men need it for sperm quality, while women rely on it for hormone balance. Low levels can disrupt cycles or complicate pregnancies. Libido suffers too, since vitamin E supports blood flow, critical for sexual health. Your nervous system takes a hit without enough vitamin E, as nerve cells become more vulnerable, worsening neuropathy. Kidneys struggle with increased oxidative stress, raising the risk of damage. Eye health declines faster as vitamin E protects retinal blood vessels. For your heart, vitamin E keeps arteries flexible, reduces inflammation, and prevents cholesterol oxidation, lowering the risk of heart disease, a leading concern for diabetics. At the cellular level, vitamin E stabilizes cell membranes, preserving essential fats in nerves and muscles. It improves insulin sensitivity by reducing inflammation and helps glucose enter cells efficiently. It also regenerates other antioxidants like vitamin C, amplifying your body's defenses. Without enough cells weaken, inflammation rises, and diabetes complications accelerate. Boosting vitamin E is easy with the right foods. Sunflower seeds are a standout. 1 ounce gives 66% of your daily needs. Almonds pack 48% per ounce, and hazelnuts offer 28%. Cooked spinach provides 20% per cup, and avocados deliver 15% per medium fruit with healthy fats to aid absorption. For gourmet options, try a Mediterranean sea bass with almond pesto crust, 180 grams of fish, and a quarter cup of almonds covering 70% of your need with omega-3s. A Japanese duck breast with hazelnut soy glaze, 200 grams of duck, and a quarter cup of hazelnuts delivers 65% of your vitamin E. Or enjoy a French avocado and sunflower seed salad with truffle vinaigrette, 150 grams of avocado, and 2 tablespoons of seeds for 60% of your daily intake. Supplements can help if food isn't enough. Choose natural d-alpha-tocopherol for better absorption. Pure encapsulations vitamin E at 400 IU per soft gel is a top pick. Now, Foods Vitamin E, also 400 IU, includes mixed tocopherols for broader benefits. Stick to 400 IU daily, as too much can thin blood. Check with your doctor first. Some habits drain vitamin E. Processed vegetable oils like soybean or corn oil increase oxidative stress and deplete stores. High-carb sugary diets fuel inflammation, burning through vitamin E faster. Alcohol damages the liver, impairing vitamin E storage. Low-fat diets hinder absorption, so include healthy fats like olive oil. Overcooking vegetables destroys vitamin E, so steam or eat them raw. Vitamin E is a protector for diabetics, improving insulin sensitivity, reducing nerve pain, and safeguarding heart and eye health. If your skin's dry, your nerves are acting up, or your blood sugar's stubborn, you might need more. Let's wrap up with our final vitamin. Number 3, vitamin C. Vitamin C is a superstar antioxidant, but diabetics run low more often than you'd think. High blood sugar competes with vitamin C for cell entry, reducing absorption. Oxidative stress from diabetes demands more vitamin C to neutralize damage, and frequent urination flushes it out since it's water-soluble. Early signs of deficiency include fatigue, as vitamin C fuels energy production. Easy bruising or slow healing cuts suggest low collagen, which vitamin C supports. Bleeding gums, dry skin, or frequent colds are other clues. Joint pain or stiffness can worsen as vitamin C protects cartilage. Severe deficiencies can cause iron deficiency anemia, leading to weakness and dizziness. Low vitamin C affects major systems. For fertility, it protects sperm and eggs from oxidative stress, boosting motility in men and ovulation in women. Libido dips without it, as vitamin C aids blood flow. Nerves suffer worsening neuropathy symptoms. Kidneys face higher inflammation, increasing damage risk. Eyes are vulnerable, as vitamin C shields retinal blood vessels, and low levels speed up vision loss. Your heart takes the biggest hit. Vitamin C keeps arteries flexible, reduces plaque buildup, and lowers blood pressure. Without it, heart disease and stroke risk climb. At the cellular level, vitamin C neutralizes free radicals, reducing insulin resistance. It supports collagen for strong blood vessels and healthy skin. It boosts immunity by empowering white blood cells and regenerates vitamin E, strengthening your antioxidant network. Without enough, cells inflame, age faster, and complications progress. Food is the best way to load up on vitamin C. Kakadu plums are unmatched. 100 grams provide over 3,000% of your daily needs. Acerola cherries offer 1,600% per 100 grams. Red bell peppers give 200% per 100 grams. Kiwis, 150%, and strawberries, 90% with fiber to stabilize blood sugar. For gourmet dishes, try a tropical kakadu plum and citrus seared salmon with bell peppers, 150 grams for over 2,000% of your needs. A Japanese yuzu tuna tartare with kiwi salsa, 180 grams, delivers 1,000%. Or enjoy a French acerola cherry mousse with dark chocolate, 120 grams for 800% of your vitamin C minus sugar spikes. Supplements are an option if needed. Liposomal vitamin C, like Live On Labs, 1,000 milligrams per packet, offers superior absorption. Pure encapsulations, ascorbic acid at 1,000 milligrams per capsule, is another great choice. Aim for 500, 1,000 milligrams daily, but higher doses may help during illness. Check with your doctor. Some habits deplete vitamin C. High sugar diets block its absorption. Alcohol increases oxidative stress draining stores. Overcooking destroys vitamin C in vegetables, so steam or eat raw. Smoking burns through it quickly, and processed foods lack the fresh produce needed for stable levels. Vitamin C strengthens immunity, improves insulin function, and protects against neuropathy, kidney issues, and vision loss. If you're battling infections, slow healing, or constant tiredness, low vitamin C could be a factor. Getting enough through food or supplements can transform how you manage diabetes. Vitamin B6, E, and C are critical for diabetics. They enhance insulin sensitivity, protect nerves, reduce inflammation, and lower complication risks. Food is the best source. Think chickpeas, salmon, almonds, avocados, bell peppers, and kiwis. Supplements can fill gaps, but always consult your doctor. Avoid sugar, alcohol, and overcooking to preserve these nutrients. If you're feeling off, tired, achy, or struggling with blood sugar, these vitamins might be the missing piece. If this video helped, please subscribe and leave a comment with your questions or experiences. Share this with someone who might benefit. Managing diabetes isn't just about meds or diet, it's about giving your body the tools to thrive. Let's take control together. Thanks for watching and stay healthy.